Specifically in the lung cancer session, we had excellent speakers. One of the speakers that we had today, for example, gave the plenary session yesterday. So Dr. Mariam Jamal-Hanjani is working with Charlie Swanton in the London group at the Crick and UCL, and they're doing many studies such as TRACER-X and PEACE, where they're following what happens in the molecular profiling of non-small cell lung cancer. It was really useful to have an update from Mariam about what's happening with those studies, which are going to be extremely informative in allowing us to understand better the different kinds of lung cancer, the different options for targeted therapies in the future, and just what to expect in development of adjuvant treatments in the patients who've had resected tumours as well. Some of the other speakers, for example, we had Professor Dennis Talbot from Oxford, and Dennis tackled quite a new topic in lung cancer. There's a marked increase in the number of patients with neuroendocrine tumours of a lung cancer primary type. And Dennis was overgoing the pathology, the new data, the imaging, and really making us think about the way in which we treat these patients now. So Dennis's talk was definitely one as food for thought and could lead to some subgroups developing within the UK to make sure that these rare patients are treated optimally in every centre throughout the country. Professor Fiona Blackhall from the Christie spoke about non-small cell lung cancer and small cell lung cancer to do with the therapeutics, but also to do with circulating tumour cells. And the research ongoing there is exciting. It's beginning to give us results on which we might be able to work and again develop new treatments. Fiona's review was an update from ASCO as well, and the new data on the EGFR mutant non-small cell lung cancers and the ALK translocated tumours was very informative and most welcome. The other speaker we had just yesterday, the first day, was Dr. Alistair Greystoke from Newcastle. Alistair is a great guy and really delivers on research for non-small cell lung cancer. So once again, he was updating us and being quite controversial regarding where we are with immunotherapies for lung cancer. So there were questions from the audience about the duration of therapies for immunotherapy, the affordability of treatment, and also other specific questions about how we select patients. And clearly, to get the best outcomes for patients and the best outcomes for our cost-beleaguered NHS, we need to have answers to those questions too. The final speaker that we had was Mr. Alan Kirk, and Alan is a thoracic surgeon in Glasgow. Alan is like a boy with a new toy because he has a new robot that's doing his surgery for him, so I would say. Alan is very excited about progress in surgery for lung cancer, and he covered not only the non-small cell lung cancer subtype, but also small cell, where although the patients are rarely diagnosed at a stage where surgery is feasible, it's really important that we don't miss them because there are long-term cures recorded. He made the point that because it's unusual, we're not going to be able to run clinical trials on these patients. They would take too long to recruit and it would be too difficult to get the level 1 evidence for it. But Alan convinced us that we need to remember that surgery is an option for those patients.